Hello and welcome to another bite-sized med education video from Spear Medical. I'm Eric, and today I'm going to be talking to you about responding safely and utilising the scene assessment. Now, when we're talking about the scene assessment, whether we're working at a sort of new to first aid environment, or if we're working all the way up to paramedics and pre-hospital doctors, responding safely is still critical, and actually this system that I'm going to talk through today, scene assessments, can be used at any level, at any skill grade. So hopefully this is applicable to quite a lot of our viewers, and if you're not familiar with it, it'll introduce you to it, and if you are familiar with it, hopefully this will serve as a nice recap into its use. So, like I said, regardless of what sort of clinical grade you're at, all of our primary surveys start with check for danger or is the scene safe, etc. All that this is a tool to structure that is the scene safe question a little bit better, and also take into account the need for extra resources and sort of sizing up what's going on before you even touch the patient. So, starting off with S, this is straightforward. Safety. Is the scene safe? So it's not just is it safe now, but actually, is there any developing safety concerns as well? So whilst it might be immediately safe, is there any safety concerns that might occur throughout the episode of care with this patient? We're also thinking who needs to be safe. So obviously us. But also our colleagues, so that could be your crewmates, that could be other agencies at scene, and obviously the patient and bystanders, any members of the public that are still around, and what can we do about that to help keep them safe. So any safety concerns now, any that could develop, and safety of ourselves, our colleagues, the patient, and any bystanders. Next we move on to C, which stands for cause. So that's our moment to pause and consider the mechanism of injury, so MOI. Is it something like a car accident? Have they fallen from height? If so, how high did they fall? If it was something like a car accident or a fall from height, was it truly an accident? What was the patient doing before it happened? Did they go unconscious at the wheel? Can any witnesses say that, for example? That turns it from a patient that's poorly because of trauma to a patient that's become poorly and thus crashed their vehicle, for example. So the mechanism of injury, but also the events surrounding the accident that's happened, or the incident that's happened, and what information you can draw on that to start predicting likely injury patterns, the likely destination that this patient's going to need to go to, etc. Next, E stands for environment. Now, this isn't just as simple as is it hot, is it cold? That is part of the question, is it hot, is it cold? So weather. What impact is that weather going to have on your patient, but also yourself? Are you wearing appropriate clothing for the weather that you're in? If you're going to be looking after this patient for some time, are you adequately protected from the elements, either heat or cold, so that you don't become a casualty yourself? But we're also thinking things like lighting. So is it really dark? Is the patient in a dark place, but there's something like a street light nearby? Can the patient be moved to that light, more well-lit area, if clinically safe to do so? Or can we just bring some lighting to the patient? So the fire service are really good at this in terms of bringing scene lighting, but everyone's got mobile phones nowadays, and generally some artificial light can be produced, for example. We're also thinking things like, is there any embankments or access or egress issues to consider when getting to the patient? Are we going to have any difficulty getting ourselves into the patient, or any difficulty extracting the patient from the place that they're currently in? Next is N, which is number of casualties. And this is, I'd also add on to here is also triage, because just a mental note that if there is more than one casualty, we need to do some effective triage to work out the types and severity. that will help inform us. One, that'll guide us to the patient that needs us the most if we're on our own, but it'll also help inform our decision about the next question, which is extra resources required. So, yes, it could be as straightforward as there is 4 patients, therefore we need 4 ambulances, for example, if they're all severe enough in terms of injuries. But also, we're thinking things like other agencies that might help us here. So things like Coast Guard, the Fire and Rescue Service, police. If we're talking sort of an ambulance point of view, we can think of things like pre-hospital doctors. And honestly, I could go on for quite some time with other sort of agencies, mountain rescue, etc. But also things like gas and utility companies, if we're talking building collapse with unsecured electrical mains or gas mains, etc. So it's just, again, your chance to think, do I need any extra help? If so, what? So is that more clinical help, or is it more help to make the scene safe and mitigate some of the hazards that we identified during our initial safety assessment? So this is the scene assessment. So the plan is that you work through your scene assessment before you even get hands on the patient. I hope this was useful to you. If you did find it useful and you want to see more content, just drop us a like on this video and please subscribe. Thank you very much for listening. I hope it was helpful. Goodbye.